My name is Teresa Hagan. I'm an assistant professor at the School of Nursing here at the University of Pittsburgh. And I wanted to talk today about a pitch that we're hoping you'll get involved with, dealing with patients with cancer and their finances. So imagine you're a clinician, a nurse, a physician, a social worker, occupational therapist, anyone working at UPMC. And you work on an oncology unit and you're caring for patients with cancer. And your job is to make sure that your patients stay healthy and engaged in their care. But you notice that a lot of your patients are not just struggling with managing their cancer, managing the side effects, but they're struggling with the finances of cancer care. This is something that we're seeing more and more in the hospital, and we're trying to find ways to understand and to approach this growing need amongst our patients. So take the case of a patient, Amy. Amy is in her mid-40s. She's a working professional. She has 2 kids. She's recently diagnosed with cancer. Every time she has to come into UPMC, McGee, or Shadyside, she has to call off work, find childcare, pay for travel, transportation, gas, etc. Becomes burdensome just for her to be getting her care. So she starts skipping some of her medications, maybe not going to specialist visits, maybe not going and checking in on some other healthcare problem that she's having. Not because she doesn't want to be healthy and making sure she's engaging in health promoting activities, but just the co-pays and the costs become overwhelming. In fact, it becomes so bad that she ends up taking a second mortgage out on her house, dipping into her retirement savings, and using up a lot of her sort of social support and asking for money. And while this may seem dramatic, it's actually a very real problem that, and in the past couple of years, we've been seeing impacting patients' health outcomes. So it's not just a problem of a few people, but it's actually much more severe, even in the Western Pennsylvania area. So we know that about 2/3 of patients with cancer worry about covering the cost of their care. About 1/3 go into their savings to pay for their cancer care, and about 5% actually declare bankruptcy, specifically related to the cost of treating their cancer. So we know that they're struggling. We want them to be adhering to their treatment, but as nurses, clinicians, we don't feel equipped yet to really be able to provide them with comprehensive services that both address their financial need as well as sort of the emotional impact of having finances sort of permeate their care. So our challenge, for you and for the groups of you, is to think about, multiple people involved in this situation: patients, clinicians, people at the hospital, family caregivers, etc., and help patients be able to navigate their care by using resources in the hospital, using their social networks, using the community. And the end goal is that patients are able to manage their care and to be able to feel more at ease with, accessing the care and financing the care that they need. So we really hope that you engage in this topic, and we cannot wait to see what you find out and put forward. Thank you.